This is NDTV, and you're watching NDTV 24/7.
Welcome. You're watching Living with COVID. I'm Rishika Barua. This is a show where we answer all your questions on the coronavirus and help you navigate through this new normal. Joining us as always is a panel of expert doctors to help us answer some of those questions. Dr. Manoj Vithalani, he is an MD consulting physician diabetologist from the HCG multi-speciality hospital. He's joining us from Ahmedabad. We have Dr. Kumar, who's also a consultant physician and diabetologist, joining us from the Sri Balaji Hospital and Diabetes Center in Vijayawada. Appreciate you, doctors, for being with us on the broadcast. Dr. Kumar, if I can begin by asking you, patients are still very apprehensive about accessing healthcare facilities. People feel like if they go to hospitals or clinics, they could be at a risk of contracting the coronavirus. Could you elaborate for our viewers? What are some of the things that you're doing, for instance, to keep your patients safe?
Ma'am, actually, first I'm making sure that patient is confident enough to come to the clinic so that they don't contract the new infections while they are coming for some problem and they are going to contract other problem. We are just following some simple guidelines that our staff are being trained for the hand hygiene guidelines. And our staff will be wearing all the necessary protective equipment, and we are going to screen the patients while the entry only, because we kept a single entry point for the inpatients for the hospital. So every patient will be screened. The patient's history will be taken. The patient's family history will be taken. Like any of the patient's family members are suffering from any illnesses, we have to take the proper history. The patient is necessarily the patient has to wear the proper mask. That could be a cloth mask or a three-ply surgical mask. So all the procedures which includes like the paper bills, etc., has to be minimized by using the digital technology. Like we can share the bills, etc., the payments through the digitalized apps or the SMSs. And regarding the patient care, what we are taking is what we or any other doctor has to take care is every patient has to be screened, and the patient's attenders has to be we should only one attender should be allowed with the patient, and the temperature has to be monitored at the point of entry, and if the temperature is there, the patient has to be sent to the confined area where the staff will be ready with the wearing the mask and the shield and the gloves, and they will be taking the proper history. And the hand hygiene points has to be set in all corners of the hospital or the clinic for the hygiene of the patient. And the second thing is we have to monitor the saturation also for the patients who are coming to the clinic. In the entry point only, some staff has to be designated with the saturation pulse oximeter, so that if any patient saturation while entry is less than 96%, then we have to separately screen the patient and evaluate for the COVID infection. So by taking some certain precautions, we can prevent the transmission of in-hospital infection from the patient who are positive to the normal patients.
Dr. Manoj, if I can come to you, there's a lot of confusion among patients about the difference between being asymptomatic and pre-symptomatic. Also, if you would like to elaborate on how important it is to carry out contact tracing, I beg your pardon, of all those patients who have tested positive and isolating them.
This is very important questions, because we are seeing the many asymptomatic patients, those who have suffered already a COVID-19 disease, their close relative, first degree relative, or friends who met the person that is positive. So these are the contacts of the first contact of the patients who tested positive, and these patients we have to quarantine them at least for 14 days. And this remains asymptomatic initially, and then late may develop the symptoms. And if they do go for the testing on the 5th day, then they may be a positive, then we have to consider these patients, if they do not develop any symptom, then asymptomatic positive patients. If you follow these patients up to the 10th day, up to the 14th day, some of the at least 50% of the patient, 50 to 60% of the asymptomatic positives turn to be some symptoms they develop after the 10th day of the illness. These patients are considered as a pre-symptomatic patient. So most of the patient asymptomatic positive, when you trace them for 14 days, nearly 60 to 70% they develop some symptoms. So these are called as a symptomatic patient. Asymptomatic, those who do not develop the symptoms up to the 2 weeks, then they considered as an asymptomatic carrier. So these are the close contact of the positive patient. To be contact tracing must be done. They should be quarantined. They should not allow to move around the society. If they may allow to move, then they likely to spread the disease very fast, because the infectivity rate of the asymptomatic patients and the symptomatic patients in initial first 5 to 7 days, infectivity is same. So we have to follow the strict rules for the quarantine for the asymptomatic positive patients.
All right, very interesting. Dr. Kumar, the other big question that everyone has in their mind right now is, to be able to distinguish between what is a common flu versus, what is actually coronavirus, because a lot of the symptoms between a common flu and coronavirus appear to be the same. How can patients distinguish?
Yes, ma'am. First of all, there are lot more common things between the coronavirus and the seasonal flu, that is common flu. There could be fever, dry cough in both of the common flu and the corona. But if any of the person who is developing in the common flu, what happens? The patient will be having fever, dry cough, body pains, but there would be a running nose and a sore throat. Whereas less likely in the COVID patients, the running nose or nasal stuffiness would be less. So we can simply differentiate between if there is any running nose like that. And in corona patients, there would be loss of smell. The patient starts losing the ability to smell the objects. So, and the taste also. The patients would be difficult. The patient will be having a new symptom, like they will be identifying the taste would be difficult for them. So, if any symptoms like losing the smell or the taste and any new onset breathlessness. Whereas in a seasonal flu, there won't be any major symptoms of breathlessness. But whereas in a corona fever, like coronavirus infection, the patients will be having the fever, dry cough, and at the same time they will be starting developing a new onset breathlessness, which they would not have been having before. So if they have any such symptoms, then definitely they should go to the nearest hospital for the evaluation of the COVID.
All right. So that's, of course, essential differences between the two.
The COVID, yes, ma'am.
Right. All right. Dr. Manoj, the other big question, of course, is around testing.
Yes.
And it is being observed in many places that in the absence of the RT-PCR test, which is considered to be the gold standard, there are patients who are undergoing CT scans. Now, is that effective and reliable? Is that something that a lot of doctors are now recommending?
Yes, CT scan is a very important test, because the chest X-ray sensitivity and specificity is very less, is even less than 50% in the first week of the illness. Usually chest X-ray comes positive after the 1 week of the illness. So those CT scan is very important diagnostic tool, which favors the whether corona infection is present or not. If we do the CT scan, especially those patients coming to the emergency room, and they may not have a classical history of the fever, but some sort of the fever and mild cough and sore throat, and may have a contact with the COVID-19 patients, and or those patients going for the cesarean section, any emergency surgery. This patient is opted for the initial CT scan. Those who have developed some sort of the illness in the first week, then they may show the CT scan positivity, especially ground glass opacity. Those who have ground glass opacity with the CORAD, there is a scoring system for the CT scan. Those who have CORADs more than 3 or 4, then they have high likelihood of the COVID test positive. So such
Right.
patients, CT scan in screening
But-
patients,
right.
so where their exact history is not available, and the patient is either going for any intervention, surgical intervention procedure, heart coronary angiography, or any coronary intervention procedure, or some sort of the surgery like cesarean section, cancer surgery, or any emergent procedure.
But
The
doctor-
CT scan is very useful
All right.
tool to diagnose.
Okay, you're saying the CT scan is extremely useful, especially when you're undergoing an emergency procedure. You may not necessarily have the luxury of time. On that note, we're going to slip into a very short break, but our panel of expert doctors will continue to be live with us on the other side. Stay tuned.
Knowledge Partner, USV, your reliable healthcare partner.
Welcome back. You're watching Living with COVID. We have Dr. Kumar as well as Dr. Manoj live with us. Dr. Kumar, if I can come to you at this point, what's
Yes,
the
ma'am.
advice that you'd like to give patients who are suffering from diabetes, and how can they effectively manage their condition at home?
Yeah, ma'am. Diabetes is a chronic condition, and most of the people might be already on the medicines and the regular follow-up with the concerned doctors or physicians. So, if you say the values of the sugar levels, normal fasting sugar should be less than 126, and the postprandial sugar should be less than 160. Sorry. So regarding the patients who are already diabetic, during the season of the lockdown and the COVID, if they are unable to go to the hospital, it is very simple to manage at the home, but having a glucometer at the home and regularly monitoring the sugar levels at least weekly once after the breakfast and once after the lunch, and at different times of the day, post lunch or post dinner, so that if the sugar levels are more than 160, then they would easily connect to the concerned physician through the telemedicine app, etc. Provided the sugar values are less than 200 or 250. If the sugar values are more than 300, definitely they may need to have some investigations and get the sugar levels under control. And regarding the management of diabetes, along with the medicine, the patient has to follow regularly strict physical activity, like at least 30 minutes of walking daily, which is depending upon the area's possibility, like if it is a containment zone or we cannot say. And the diet, regarding the diet, the patient has to reduce the carbohydrate content. That means they have to reduce the rice or the wheat content which they are taking. They have to completely cut down the sweetened drinks like cool drinks or any aerated drinks. And they have to reduce the alcohol intake, smoking intake. If they have to definitely stop the smoking. And the sugar levels, there are two types of diabetes which we regularly see, like the type 1 and type 2. Type 1 patients' sugar levels keep on changing, keep on fluctuating. So definitely the patients who are suffering from type 1 diabetes, they would be, majority of the patients would be on the insulin. So they need to have the proper monitoring of the sugar, and they should keep the sugar levels always under control. And if the sugar levels are fluctuating very rapidly, then definitely they have to keep in touch with the concerned physician, and they can head as only for the diabetes, they can be treated on the online apps also from the concerned hospital or the doctor. When they enter the sugar values, then when we can adjust the sugar medicine or the sugar insulin according to the patient's
Right.
sugar reports.
All right,
Yes,
very
ma'am.
interesting advice there. Dr. Manoj, if I can come back to you and talk a
Yes,
little more about testing, because you've touched upon that in the past as well. Could you explain to our viewers, the role of an antigen test, a rapid antigen test versus the RT-PCR? How are these two tests different in terms of cost, speed of the result, as well as reliability?
As we all know, the RT-PCR is a gold standard test. Although it may be 30% of the patients negative on doing the first RT-PCR. Similarly, this rapid antigen test is a similar type of the test, but that's very immediate test. It also has some positive, but those who have a rapid antigen test positive, that to be confirmed by the RT-PCR, because rapid antigen test, you do not know about the viral load. Cycle threshold value you will not get on the, and the false positivity is also very less likely with the rapid antigen test. So rapid antigen test, when you are screening for the close contact patients in the containment zone, or and the any those who have a likelihood as many patients from the one area. So we have to screen these all nearby the patients living area that. So the rapid antigen test is a very useful test to diagnose early, and those who are positive, they may undergo the RT-PCR when they consult the doctor to know the viral load. So, and the negativity of the rapid antigen test is similar, like 30 to 40% of the patients may have a positive corona infection, still they may have a negative. So, those who have a negative rapid antigen test with the classical symptoms, they may consult the doctor and opt for the RT-PCR gold standard test.
All right, very interesting to understand the difference between the two tests, how they are used, etc. Dr. Kumar, if I can come to you, what's
Yes,
the
ma'am.
advice that you'd like to share with patients when it comes to the management of elderly people at home? What should be the protocols? What's the special care that can be taken for the
Yes,
elderly,
ma'am.
given the fact that it has been established that they are more vulnerable to the coronavirus?
Yes, ma'am. Regarding the care of the elderly, as we all know, we are in the just the lockdown have completed, and any of the family members have started moving out, ma'am. So definitely the persons whose family has the elderly people has to be having a separate room for them, and the person who goes out for the work daily should have to maintain the distance at least till the vaccine comes from the elderly people, so that he may not, because the younger people may not be at the risk of infection, but they may be a spreader, so he may be a carrier for the home elderly person. So regarding that, the patient has to take care. The elderly people has to be given a separate room in the home, and they have to be in far distance from the patients from the persons who are going out regularly. And regarding the second thing, most of the elderly people would be suffering from the chronic diseases like the hypertension, cardiac, or like asthma or the diabetes. So definitely the hypertension and the asthma, like the hypertension and the diabetes should be controlled. The hypertension, the blood pressure of the patients should be definitely under control, and the sugar levels of the patient should be controlled. And for the time being, till the vaccine or the update come, the elderly people and the younger people have to be taken care of regarding the any infections or any symptoms in the initial stage. Only they have to be evaluated, so that we can do the treatment
Right.
as earliest as possible. Yes, ma'am.
All right. I just want to, Dr. Kumar, ask you a very quick
Yes,
follow-up
ma'am.
question on this, which is,
Yes, ma'am.
what should one do in order to make sure that, especially young people in the house who are, going to offices or are stepping
Yes,
out
ma'am.
on a regular basis now, don't,
Okay, ma'am.
don't pass on the infection
Ma'am,
if at all they are
definitely,
asymptomatic
ma'am.
carriers.
What I mean to say is, the young people definitely they need to strictly follow some protocol. That
Yes.
ignorance should not be there. The young people they may be safe, but they have to remember that they may go home and they may contract the disease to the elder persons who in the home. So definitely wearing the mask while going out, applying the hand hygiene procedures are a must for the people who are
Right.
going out daily. So that they have to keep in mind that some people are just try to experimenting what happens without mask. So better they have to wear the mask, keeping in mind the elderly people and the children who
Right.
are at their home.
Right.
Yes,
All
ma'am.
right. So, of course, there has to be, extra care that has to be taken.
Yes, ma'am. Yes, ma'am.
Dr. Manoj, if I can come back to you,
Yes.
once again
Yes,
on the
ma'am.
issue of testing. What are the steps and
Yes.
protocols that are in place for safe testing, especially imaging tests like CT scans, etc., given the
Yes.
fact that you have a large number of people who must be undergoing these tests? What would you like to
Yes.
tell our viewers, who say want to or need to undergo a test to allay any fears of contracting the infection while they undergo these tests?
Actually, this is a very good question. This is always, that's why the many patients, those who need the investigation, they have a fear to go to the lab or the radiology department to whether I do not have the corona and I may contract if I go to the lab or the radiology department. This is very important questions, and we generally ask each and every patient to wear proper mask and how to wear the proper mask, that have to learn from their clinician, because this is also a very important procedure, and they have to wear the gloves, and they go to the test, and the test can be done. Usually when the test is performed, the accompanying person from the radiology department or lab they usually wear a full PPE, and they are taking care of the patients to avoid the contracting the infection. And the what radiology people do, they usually sanitize each area after each and every patient comes with the sodium hypochlorite solution 1%. So there is no need to worry about the surface contact. And all people in the hospital, they are wearing the 3-ply surgical mask or N95 mask. And those patients come with the already having a COVID-19 infection. Then we have to to take care of the patients as well as those who are doing the test in the department. So the attendants from the department, staff from the department also should wear a full PPE to avoid contracting the infection from the patient to them. And those who are non-COVID patients coming, then they have to take care of the proper sanitization.
All right, so that's extremely important information there on how various facilities are being kept safe so that there is no spread of the coronavirus. I'm afraid that's all we have time for. Thank you so much, doctors, for joining us and answering all our questions.
Knowledge Partner, USV, your reliable healthcare partner.